It's 8 o'clock. Good evening, everybody, and welcome to today's episode of Marvelous Medicine, which is on dysphonia. The speaker is Dr. Jayakumar Menon. I must thank Dr. Unnikrishna Menon, who is the professor of ENT at Amrita Institute of Medical Sciences and faculty of the Medical Education Department at Amrita Institute, Kochi, for introducing me to Dr. Jayakumar Menon and for getting him on board. Dr. Unnikrishnan has been on Marvelous Medicine before. However, for anyone who's logged in for the first time today, he did his MBBS from TNMC Medical College and Nair Hospital and MS ENT from KEM Hospital in Mumbai. He's the executive editor of the Amrita Journal of Medicine and an editorial board member of the National ENT Journal and the Journal of Medical Evidence. He likes to write, and his articles have been published in newspapers, and he has translated books as well. His passion is quizzing, and he's the patron founder of Amrita Quiz Club and Cochin Quiz Club. Actually, I tried to sort of con only into doing a session on how quizzing could be used as a pedagogy tool, but he decided that he'd rather do a session on quizzing for fun. So in the coming weeks, we'll be having only speaking on our Beyond Medicine session about how quizzing can be a good outlet for doctors. I'd request Unnikrishnan to introduce Professor Jayakumar Menon.
Thank you, Ravi. Yeah, so looking forward to that session. That's next month, I think. Good evening, everybody. I know it's we always start off with saying it's an absolute pleasure to introduce, but it's genuinely a real pleasure to be introducing Sir Jayakumar sir today to a new audience relatively, because believe me, in ENT surgeons and laryngology circles of India, he is a absolute numero uno name. Dr. Jayakumar Menon is presently the director of Dr. Jayakumar's laryngology group in Thiruvananthapuram, which to sort of put things in perspective, he is the first exclusive laryngologist of the country. So it's an area of subspecialization. So when you say ENT, you know there is otology, rhinology, laryngology. For the longest duration, otology was the big brother. Laryngology was the unseen sibling. Slowly that has changed over the years, and now, especially thanks to people like Jayakumar sir, it's a huge branch now, and a lot of takers, and especially more so in India. In the world itself, India is a recognized center of laryngology thanks to the efforts of people like Jayakumar sir. And for many of us who are in the laryngology circles in India, it's almost like we say it's like a Pavlovian reflex. You hear about voice, dysphonia, any problems, immediately the first name comes to mind is Jayakumar sir. And he has been a fantastic teacher and guide for all of us. Any doubts, anything, any issues we have, and of course in academic programs, his name is on the top of the list. So that's how it has been for Jayakumar sir, and he is presently the director of his own center. We have a National Association of Phonosurgeons of India. He was the founder, vice president, and past president of the association. His medical education career began at Alappuzha Medical College in Kerala, as MBBS from there, and it is DLO from Trivandrum Medical College, followed by MS ENT from Kottayam Medical College, all in Kerala. Then he did the DNB of National Board, and then FRCS from Glasgow. After that, he returned and he started off his tentative, betting his toes in water of laryngology. And then there was no turning, literally there's no turning back. All the aspects of laryngology, basically, which includes voice, swallowing, airway, all have been covered by him and mastered by him, and involves a lot of research also. And especially in this field, voice and dysphonia, there is nobody just quite like him. And quite sure that all of you who are sort of new into this thing will be enlightened beyond words. So I hand over the mic and to hear Jayakumar sir's about voice and approach to dysphonia.
Thank you, Unni, and thank you, Dr. Vidya, for giving this opportunity. And thanks, especially thanks to Unni for saying so many nice words about me. So let me start. Just let me know how much. What is exactly the duration of this talk?
It's 40 to 45 minutes. Sir.
Correct,
After that, we'll
correct.
have
That's the best. Yeah, yeah. 40 minutes is the maximum.
Yes.
No.
But just to tell Jayakumar sir, there'll be a lot of discussion from what I have experienced this marvelous medicine. There'll be expect a lot of discussion.
Really, yeah.
So it may
Okay.
go on to much longer.
So shall I start sharing the screen?
Yes, sir.
Yes, sir.
You can see my screen?
Yes, sir.
Yeah, thank you. So good evening all. So today we are going to talk about it because when Dr. Unnikishan told me about this, I didn't know what was the plan. Then I discussed with him and Dr. Vidya and then have got a rough idea how it goes like that. So I know that it is predominantly doctors, but this is not a laryngology talk. So what I will be doing is that to do a general talk on voice and dysphonia. Actually, even though I put it the name as dysphonia, first half I will actually go about discussing about the fascinating aspects of the voice, especially the human voice and also how it evolved. And then in the second half, I will talk about few very striking voice disorders, which are not rare, which you yourself might have come across when somebody is speaking that way, and what are the possible options. So it is like a sort of the overview of a voice. Okay, we all know that, voice is part of the personality, and voice really contributes to the personality. And probably the best example would be the big B. Is so majestic, deep, booming, low-pitched voice of him is so characteristic, almost a signature voice, you can tell.
कभी कभी मेरे दिल में ख्याल आता है कि जिंदगी तेरी जुल्फों की नरम छांव में गुजरने पाती तो शादाब हो भी सकती थी। ये रंज और गम की स्याही जो दिल पे छाई है तेरी नजर की शुआओं में खो भी सकती थी, मगर ये हो न सका और अब ये आलम है कि तू नहीं, तेरा गम, तेरी जुस्तजू भी नहीं। गुजर रही है जिंदगी कुछ इस तरह जैसे इसे किसी के सहारे की आरज़ू।
So, where does this voice come from? We all know that it is from the voice box, but what are the intricacies? What are the details of the voice? That is what we are going to see today. So, about the genesis of voice, what is the origin? Now, we knew that one of the great among the triumvirates of Carnatic music, Saint Tyagaraja Swami had told that Nabhi Hritkanda Rasana. That means the voice, the deepest voice come from the abdomen or Nabhi. Next comes from the Hrit, that is the heart. Then Kantha, that is the neck. And the highest was from the Rasana, the upper part of the face. That is understandable because when we do very low pitch sound, you get a feeling of a vibration in the lower part of the chest and abdomen. And little more higher, you get the chest vibration. Then you feel that the vibration is in the neck. And finally, when you are producing a real high pitch, what the musicians called is the head voice. You get a sort of a vibration around your mouth. So that was understandable. So at that time, it was thought that the voice originated different places. But now we know that it is not like that. We understand the science of voice much better. It is easy to understand the voice if you think that human vocal apparatus is comparable to a musical string instrument, be violin, be it guitar, whatever it is. So it has got three parts essentially. One string or more than string need to be there because the strings are the vibrating source. And who will set the string into vibration? You need a force. So in all musical instruments, somebody plugs or they use a rod to set the string into vibration. But the third part is probably the most important and most contributing to the individuality of the voice. That is resonance. You know that all this musical instrument has got a hollow part. So if you take the string of this violin and put across the wall onto a few nails driven there, not even the greatest violin expert can produce the violin, the beautiful voice of violin, because the individuality, the character is produced by the resonance. And for that, you need the vibrating chamber, the resonating chamber. So in human beings also, we will see that. So before that, just see that how does it work. So we have seen the three parts. The force he is applying with the rod, the strings, multiple strings on which the tension was being controlled by his finger, and what is the force in human being, human vocal apparatus? It is the exhaled air. No, we take the air inward, and that when the air comes back, the vocal cords are adducted and the vocal cords are set into vibration. That is how you do the sound. So exhaled air is the force here instead of that rod in violin. We can theoretically and practically also we can produce voice on inhalation, but that is very rare. Suppose I produce a voice like that is on inhalation. So I can even count on inhalation like 1, 2, 3, but that we don't generally use. And as far as I know, there is one language in Africa, Swahili language, which uses few sounds with inhalation phonation, but that is an exception rather than the rule. There are in animal kingdom, if you go there are two exceptions. Again, one is donkey. The braying of the donkey, the towards that the end part of the braying is actually on inhalation, like that. And cat, not the meowing, but the purring of cat, it is actually on inhalation. But these all are exceptions, and you know that exceptions prove the rule. So main thing is that the exhalation produces the voice. So just a representation of that. This is not my video, taken from the net. You can see the lungs and the heart there, and see that that is marked, the lung power. So when you breathe in, the lung expands. And then as the air goes out, the lung becomes shorter and shorter. So that is how the exhalation, the force of the voice. Great. It's a pair of vocal cords. So doctors among the audience will be definitely knowing these two V-shaped structure, and between them is the way to the windpipe. So the upper part is actually the posterior part, or the back part of the larynx, and the lower part is actually the point of V is actually the front part. The front part is fused, the back part actually open and close. And when they close, and then the air coming from the trachea windpipe actually set into vibration. And this vocal cord vibrate at different frequencies. Males have got a lower frequency, say around 125 per second. Females and children have higher frequencies like 200, 250, even 300. So we can see that how that mechanism work. Now, what are the resonators? We have seen that the resonators are the important thing, and they give the quality, the individuality of the voice. while vast majority of the musical string instrument has got a very one or at the most two resonating chamber. We have many. The major three are throat, mouth, and nose, depending upon the shape. And mind you, unlike in guitar or veena or violin, here the resonating chambers are more, they can alter the shape. So that means you can produce different type of resonance. So that is so unique. No man-made musical instrument can match our vocal apparatus in this respect. At the force level, at the string level, our vocal apparatus is much inferior. But at the level of the resonance, it is so big. You can see this is the fluoroscopy. You can see that here, this is one of my colleague, Dr. Rajasri Menon. She's actually a vocalist. So she's singing and we can see that the palate, the tongue, and the fall all moves and how the cavity. So the posterior part is the throat, this is the nose, and this is the mouth.
Parvati Nayaga Pahi Bhalalochana Parvati Nayaga.
So that's a resonance. The tongue moves, the palate moves, all these things. Say, now I am talking in my standard voice. I can make my tongue retracted and then talk like this. This is not the vocal cord. I am actually bringing my tongue back. And then I have got a closed throat resonance. I can change my nasality, increase my nasality and speak really hypernasal. Now the sound has gone through the nose. There are people who speak more nasally. So different types of resonance is possible. So that is the third most important part of the voice. Now, the difference between a musical string instrument and the human voice is that they end with that three functions, the three features: the force, the vibrator, the resonator. But we have got an additional magnitude where these sounds are converted to meaningful speech by the process of articulation. For that, you require the lips, the tongue, the palate, the uvula, all those things. So it will actually make. So that makes it even more unique. And resonance is so the articulation is so important. Again, you have seen that young lady using her lips, the teeth, the mouth so brilliantly, so beautifully, to make the voice bright and live. Like you have been now familiar to my voice for the last 5-10 minutes, and now you have got an idea. But suppose suddenly I start speaking with my lips very stiff, like the stiff upper lip, and I'm using the same vocal cord, but my upper lip has become very stiff. See that the voice suddenly become dull. The bigger the mouth opening, the bigger the lip movement, the voice become more bright. Again, suppose I talk like with clenching teeth. If I speak, even my voice is, even if my vocal cords are good, see that the quality, the life of the voice is gone. The moment I open up, the voice become bright. So in articulation also there are important features which will actually convey, add to the color of the voice. So that is also part of quite unique to the human voice. Now, just few slides about how, anybody who is interested in this kind the subject in the science, we will always like to know how did it all evolve. So if you look into the evolution, we know that the first animal which developed larynx is in lungfish. Not all fish. You know that vast majority of 99% of the fish doesn't have larynx. They have got only gills. But this is a very unique fish in African region, where actually that fish can actually breathe from water as well as from air. So during the prolonged summer, when there is no water at all, this actually hibernates and actually breathe through from the air.
Air-gulping lungfish is able to cope with these extreme conditions, but it's still exposed to the heat and it's still at risk from predators. So it relies on another, even more extraordinary ability. It finds a new, safer home buried underground. Digging down by eating mud and pushing it out through its gills. To stop it drying out, the lungfish exudes a special mucus from its skin, covering itself in a thick layer that hardens to form a waterproof cocoon. Only a single hole is left for breathing. Baked into this mud sarcophagus.
So that's actually quite a unique mechanism. So that was how the larynx started evolving. But larynx began as a sphincteric organ. It will actually prevent the food from going to the windpipe.
Gulping lung.
Now, then came the reptilian larynx. The evolution went on, and the snake, and they all had larynx. But the problem here is that in our vocal cord, 3/5 of the vocal cord is membranous, and only 2/5 is cartilaginous. So that membranous cord will vibrate beautifully, and we can create different types of voice. While the snakes and the reptiles have got practically totally cartilaginous vocal cord. So they can at the best only hiss. No, not much of a voice is possible. Can see a circular thing like that, that triangular thing. That is the larynx. It is so close to the lower teeth. You can see that larynx is opening and closing. So this is a mechanism. This is a different mechanism of the nature whereby by keeping the larynx very, very close to the lower teeth, the snake won't suffocate or asphyxiate. Again, so you can see that the larynx opening up here, and above the mouth cavity is so big. So this is almost like a nature's tracheostomy. With that will make the snake able to eat a prey much bigger than its mouth, because it can also intentionally dislocate its temporomandibular joint and this nature's tracheostomy, where the larynx is almost close to the lower incisor. So even the bigger prey, nothing will happen. The snake will survive, but it is entirely cartilaginous. So the voice function is not very great. Now, birds, we all know that, the birds have got different ability to sing. But the unique thing about snake is that their vocal cord doesn't produce voice. That's, we all thought that, or we might have been thinking that the vocal cords of the birds must be great because they produce beautiful melodious voice. But there is another structure called syrinx here that is just above the carina. Carina means trachea divides into the right and left bronchus. So at the carina, there is an air-filled sac called syrinx, and syrinx is the source of voice for the birds. It actually produces sound. Why? Why the vocal cord cannot produce the voice in birds? We know the reason. Because birds are high flyers. And when the high flyer is there, the respiratory rate will be very, very high. Imagine we are panting. We have done a real strenuous work. We have run a 100-meter dash. So what will happen? We will be breathing like, then we don't have any time to speak, because we need to have space between the inhalation. If you are taking inhalation, then there should be enough time to prolong the exhalation. If that is not there, then you can't actually produce the voice. So for the birds, the vocal cord keep on closing, opening, closing, opening. Hardly any time for the vocal cord to vibrate, because for voice to produce, the vocal note need to be opposing each other for sufficiently long time. That's impossible. So that is why the syrinx comes. So birds have good syrinx. Now coming to the mammalian larynx, almost this is a horse larynx, almost similar to human larynx. You can see the vocal cords are there, the arytenoids are there. We ourselves have conducted few this is not my specimen, dissection specimen, but we are in collaboration with the Trivandrum Zoo. Actually, we do dissect a few of the animals, whose postmortem is being done there. So we have done few. So mammals have got nearly the same, almost same structure. That is why to teach, laryngeal surgery, many times we take goat larynx, which is very, very similar. Even pig larynx is okay, because the basic structure is almost same. Now, something very unique happened in between. When the human being developed, the larynx descended. We can see that larynx is little bit lower down in the neck, right? So in all other animals, the larynx touches the soft palate here. You can see that in a chimpanzee and a gorilla, the larynx touches the epiglottis touches the soft palate. So practically that means the food pipe and the airway are completely separated throughout. In human being, there is a no man's zone, because below the tip of the uvula and up to the entry of the inlet of the larynx, it is common for both food and air passage. That is trouble, because it is crossroad. And if there is not a good traffic police controlled air, accidents are sure to happen. And larynx is the super traffic police person there. So larynx controls. It will actually set the air to the windpipe and food to the food pipe. This has to be meticulously spot on. If something wrong happens, it can be catastrophic. Even the person can die. So the accuracy has to be very, very, very great. None of the other animals have this thing because their larynx is high up. So their food pipe is always separated and from the windpipe. They can actually breathe and eat at the same time, or breathe and drink at the same time. An adult human being cannot do that. When we drink for some time, the respiration is closed. The apnea happens. In human beings, this stage where both breathing and swallowing occurring together lasts for only a couple of weeks in the neonate. Early babies, they have that ability, but others we don't have. Now you might wonder why this mechanism. The reason is that the animals, they are heavily dependent upon their smell ability. Now, if they need to have continuous sense of smell. Imagine a deer is drinking water from a river. So, if it is our mechanism of larynx, each time the deer swallows, there won't be any inhalation. And if inhalation is broken, your sense of smell will be affected. That gradient of sense. Suppose a tiger is coming from distant place, say distance. So as the tiger moves towards the deer get actually the stronger scent of the tiger, so he can actually escape. If each time the deer swallows, if there is the breakage of the air and then breathing in, then that gradient won't be there. So that is why the lower animals need that. Then if that is the case, why the tiger should need that? They also need that. They need to find out where is the prey. So this is the mechanism. But in human being, we don't need that. We are far more secure thing. So, and the larynx has descended down. Why the larynx descended? We will see. Now, drop in the neck. Why? You can see that the larynx is actually going down here. Larynx is much lower. That white thing is the tongue you are seeing. That you can see that passage of air through that. So this is. So what is the benefit of having a larynx going down? One is that, your voice become deeper. The voice become range. Say Amitabh Bachchan has got a great voice because his larynx is much too lower down in the neck. So there is a bigger resonating column between the vocal cord and the lips. The bigger the resonating column, more options for your voice. And more importantly, if the resonating chamber was very, very short, then you won't be able to produce multiple vowels. That is very important. In communication, you need vowels. So animals cannot produce many vowels. They can only produce one kind of vowel. We can actually produce multiple vowels. For that, the larynx has to be here. Do you believe that? If you want to check yourself, what you do is you try to produce a falsetto. Falsetto means the highest pitch, like a baby voice. Then the larynx, your Adam's apple, go high up here. And in that voice, try to produce different vowel. You will fail. Just watch. Now I can say A, E, A, O, everything can I. Suppose I go very high. I am going extremely high. All vowel look same. No, almost same, because that resonating chamber, the ratio between the different resonating chamber has to be different for each vowel. So larynx drop is actually a must for communication. If the larynx didn't descend in the neck, then you won't be able to do the many vowels. And without vowels, you cannot actually develop language. So that is the reason. Predominantly, that is the reason why the larynx descended. But of course, it gives much bigger resonance to the voice. Now, what is the penalty we are paying for that? That is the difference. We are the most likely ones among the animal kingdom to asphyxiate and die. Occasionally, the food will choke, right? And then die. Look at the snake. Look at the larynx in that first picture, that round thing. As I told earlier, it is very, very close to the lower teeth. And imagine, see the second picture. It is swallowing a huge egg, right? But that snake won't die because it's almost like a tracheostomy. That larynx will be below the prey and breathing normally. If ever we attempt a swallow like that, like this snake did by eating something much bigger than our mouth, that will be our last supper. That will be finished. We will die then. So this is the penalty we are paying for developing a better voice, better language. But I think that was inevitable as evolution happened. Now, if you look into the human voicing, the loudness, maximum loudness, range is 30 decibel to 125 decibel. That means if you whisper like that, it is 130. If you really shout at the top of your voice, it is 125 decibel. But usual speaking will be somewhere around 70 decibel. Who is the gold medal? Now it is the time of Olympics. Who is the gold medal winner in the loudness in the animal kingdom? It is the blue whale. Naturally, the biggest animal has the biggest voice. It's around 180. It can go up to 4 or 5 kilometers. But the surprising is the silver medal winner. We would have thought that it would have been elephant. Maybe it is lion, maybe tiger. Nothing. They all go. They are actually by the dark horse. This is the howler monkey, which is more in the the Indonesian and Malaysian region. You can see he has got a big, almost like a hollow hyoid, and it produces tremendous resonance, with the result that voice is so powerful.
We can't hear it, sir.
So that is the howler monkey.
Yeah, now we could.
Coming to the pitch. So our pitch range is around 70 to 1200 hertz. And range will say that 1 octave to 3 octaves. I think many of you may be knowing octave. If they don't know, I will just explain. So if my lowest pitch is 80 hertz, when I reach 160 hertz, I complete the first octave. In musical terminology, it is known as the mandrasthai. Then from 160 to 320, now it becomes double. Then it becomes a second octave. And then 320 to 640, it becomes third octave. So it's gone like multiple. So good singer, and for a good speech, you need only 1 octave. If you don't have any speech range, if it is just in one pitch, it is totally boring, monotonous voice. For a good speaker, you need to have 1 octave. Double frequency is okay. If my basic frequency is 80, if 160 is okay, that should be good enough. The higher the better. If you've got a better range, fine. But at least 1 octave should be there. But for a singer, you need to have at least 2 octaves, or even sometimes even 3 octaves. So we can watch here. You can watch the pitch written here. He started at sa at 120, and when the next sa comes, it will be exactly double. See, again, going back to the basic. So that is all. And you can actually go into above and below. Here again, watch the vocal. That is the lower. That's upper octave. Now he goes to the lower octave. But here again, the gold medal winner in Animal Kingdom for the frequency is dolphin. Can go 4 octave. His basic starts somewhere around 10,000. It can go to 1,40,000. Huge. Of course, there are occasional freak human beings who can actually produce more than 4 octaves.
They are kept in captivity around the world. They are very social.
Now, human voice, singing voice, we have seen that 3 octave, but 2 octave is generally okay. And this is a terrific demonstration by the late Balamurali Krishna. He go to what is known as the 4th octave, the Atitarasthai. The middle octave is known as the Madhyasthai, upper octave is known as the Tarasthai. And if you go, really high up. Till recently, Adam Lopez from Australia was the Guinness Book World Record for maximum octave. Now, the current record holder is a soprano singer from Brazil. Georgia Brown. She can go 8 octaves. It's almost unbelievable. Somebody going 8 octaves. You are talking about for 3 octaves struggling. So this is Georgia Brown.
Agudo, né? Mas vai sumir na nota, assim, ó. Aí vai.
It's almost, this is known as the whistle register. Only very few people can create that kind of voice. Now, finally, the timbre, the resonance, the quality, the individuality. Sometimes same age people, same gender will have same pitch, but their voice is different. So we can listen to 2 great singers of Malayalam film songs singing the same song differently. Yesudas and Jayachandran, 2 the greatest exponents of Malayalam film music. Just listen to the voice differently. The pitch is almost same, maybe slightly different, but it is the resonance, it is the individuality which is given.
Right. Da, Zoe, da, Zoe. Da.
ഞാനൊരു പൂ തേടിപ്പോയി ആരും കാണാത്ത പൂ തേടിപ്പോയി മാമ്പൂ വിരിയുന്ന രാവുകളിൽ മാതളം പൂക്കുന്ന രാവുകളിൽ ഞാനൊരു പൂ തേടിപ്പോയി ആരും കാണാത്ത പൂ തേടിപ്പോയി
Now, if Jayendran sings,
പാമ്പു വിരിയുന്ന രാവുകളിൽ മാതളം പൂക്കുന്ന രാവുകളിൽ ഞാനൊരു പൂവ് തേടിപ്പോയി ആരും കാണാത്ത പൂവ് തേടിപ്പോയി മാമ്പു വിരിയുന്ന രാവുകളിൽ മാതളം പൂക്കുന്ന രാവുകളിൽ.
so see, that is the individuality of the voice is given by the resonance. Now, any change in the voice, now we coming to the second part, few slides then. Any change in the voice not suitable to the age and gender is known as dysphonia. Previously, we used to tell hoarseness, but hoarseness is only one of the symptoms. Any change, suppose a male speaks in a female voice, that is not really normal voice, so then we call it dysphonia, and the other way around. So any change in the voice not suitable to the age and gender of that person is dysphonia. How you diagnose? Vocal cords are a little bit deep in the neck, so now there are technically we have got a lot of technology advance, and one is known as the flexible laryngoscopy, where you pass a small camera down the nose. You can do even on a day one child and watch the vocal cord movement. You already saw that picture when he was singing. So that V-shaped structure is the vocal cord. And there is also something known as a stroboscopy. You know that the vocal cord vibrate 125 to 250 times on an average in a second. So unless you slow down it, unless you create some other mechanism, you can't watch the vibration. So stroboscopy is sort of an optical illusion, but it slows down the mucosal wave, and you can see the dancing waves of the vocal cord. See, that's the wave. You can see that that's a wave. So depending upon the pitch, the wave pattern changes. So that is how you diagnose. Now, what are the commonest complaint? Hoarseness. Now, hoarseness means breathy plus the rough voice. Breathy means you leak air, right? With that roughness. So when vocal cord has some swellings, like, there are in terminology, we call it polyp, cyst, tumor, all these things. Here you can see on the right side, there is a globular thing. That is a vocal cord cyst, and it produces a very, very rough voice. See, on the right side, you can see that means on your left hand side, the vocal cord is bulging. So that is a cyst. Now, vocal cord paralysis, we have seen that two vocal cords. If one vocal cord is paralyzed, they won't meet. So that means the air will actually leak through, and then they will speak what is like this breathy voice. My vocal cords are not meeting. This is typical of a breathy. There are other conditions which will produce breathy voice. I cannot discuss. I'm just discussing the most common thing. So watch here, one vocal cord is not moving, and there is a gap between the vocal cord. See, the right vocal cord is not moving. That means again on your left hand side, and the left vocal cord is moving. So there is a gap between the two vocal cord, with the result that they have got this very, very breathy voice. This can happen to many reasons. One, sometimes after surgery, thyroid surgery, brain surgery, and the voice will sound something like this. See, that's breathy. Air is being leaked. It's not sharp. 1, 2, 3, 4.
1 to 10. 1, 2, 3, 4, 5, 6, 7, 8.
So that's the breathiness. Now you can get a condition known as spasmodic dysphonia. This is not rare. The The statistics is that 5 patients in 5 lakh, 1 lakh people have got this condition. Here, the vocal cords will appear normal, but the vocal cord will actually meet in a very spastic pattern. Normally, it should move smoothly. Here, it will actually. So, with the result that the spasmodic dysphonia patient will speak like that. In between, there will be tightening, and it's almost very typical. The moment you hear, you know that he's got this problem. So, this is a classical adductor spasmodic dysphonia, something like this.
It is possible. And I have this voice problems since 10 years. And when there is signs of treatment, and even
That's the typical spasmodic dysphonia, but it can be severe, like I showed. And if you look at the vocal cord, they will jam against each other. Even so, that's the typical of spasmodic dysphonia here. Now, the curious condition, male speaking in a female voice. If I speak like this, that's not a puberphonia. Very high pitch voice, something similar to a female or a child.
Three, 4, 5, 6, 7.
So it may be faulty voice mutation, or it may be a female to male transgender, and there is something known as Oedipus complex. That means in psychology, Oedipus complex means this sometimes especially the youngest son has got too much of attachment to the mother. So with the result that at the subconscious level, they don't want to become an adult with responsibility. This is a temporary thing, but unfortunately, during that time, during that puberty, if this happens, the voice gets stuck in the female voice or the child voice. And after that, he will grow out of it, that voice will retain like that. So that is known as the puberphonia, which is fairly rampant in Kerala. Now, the opposite condition, female speaking in a very low pitch voice. It is most common is the male to female transgender. Sometimes drugs like tamoxifen, other anti-estrogens, danazol, they can all produce. So,
1, 2, 3, 4,
very low pitch voice.
5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Now, what is the essential management? If there is a vocal cord growth, we have seen that cyst and all, we do what is known as the endoscopic microlaryngeal surgery. Here, a cyst is being dissected out without damaging the vocal cord. So they all are microlaryngeal surgical procedures. There are a lot of technological devices. And you can see that white thing is actually a cyst. It is being very carefully dissected out without breaking it and completely removing it and without damaging the vocal cord. This is known as a microlaryngeal surgery. So newer technology, better scope, better equipments like laser, a lot of things, coablator, all these things have actually made the endolaryngeal surgery better and better. Suppose you've got the unilateral, we have seen that the vocal cord palsy where they're breathy voice. We can correct with some early gaps with the voice therapy, or you can inject some material, filler, so that the paralyzed cord actually come closer to each other. Or there are surgeries known as laryngeal frame surgery. You can connect a new nerve, especially if it's a singer. So loads of options are there. If somebody has got a unilateral vocal cord palsy, we can always make their voice better. You can see that breathy voice. This is after surgical correction. So say 20 years, 30 years back, there was no treatment for this. We will just say that go to therapy. But now the understanding of this is much, much better. We understand. Spasmodic dysphonia, we have seen that, that a person speaking like this. Here, now there are two options. Either you can go for the Botox. You must have been familiar with that word Botox. Many people take for different purpose, like, that rhytidectomy or the facelift. It can be useful in larynx too. Or you can actually do surgery to correct this.
രണ്ട് മൂന്ന് നാല് അഞ്ച് ആറ് ഏഴ് എട്ട് ഒമ്പത് പത്ത് 2
That's
3
a typical spasmodic dysphonia. ഒന്ന് രണ്ട് മൂന്ന്. Now this is after Botox injection.
2 3 4 5 6 7 8 9 10 1 2 3 4 5 6 7
Now puberphonia, male speaking in a female voice. Very bad. No, and 80% of them can be corrected with voice therapy. Very rare, even 90%. And if they are a transgender, if they are coming relatively younger age, you can actually do hormone therapy and correct. If it doesn't come, you can do laryngeal framework surgery. This is a normal boy, but his voice was very bad. He couldn't actually be corrected with voice therapy. So we did the surgical correction.
3 4 5 6 7 8 9 10 2 3 4 5 6 6 7 8 9 10
This is after surgery.
2 3 4 5 6 7 8 9 10 2 3 4 5 6 7 8 9 10
Now the other condition, androphonia. So this was a young lady, or actually a transgender, underwent the surgical correction.
1 2 3 4 5 6 7 8 9 10 1 2 3 4 5 6 7 8 9 10
So this voice therapy, unlike in puberphonia, here the chance of voice therapy is not very high. Very rarely get corrected, but you can do a lot of surgical procedures.
1 2 3 4 5 6 7 8 9 10 1 2 3 4 5 6 7 8 9 10
Now, finally, about the voice box cancer. We know that the commonest cause is smoking and alcohol also there. Unfortunately, India still continues to be one of the leading countries as far as the number of patients with voice box cancer is concerned. You can see that left vocal cord is full of a growth. And this was a 27-year-old lady, but she was not a smoker or a person who used alcohol. Occasionally, it can happen in teetotaler too. But see, cancer larynx remains a very big threat to Indian population. Early cases, you can actually cure it completely. This is one cancer which has got tremendous cure rate. You can say 10% or 98% in the early stage. With the laser surgery, we can finish it off it in just 1 day. The treatment is over in 1 day. Or you can also do radiotherapy. But late cases, it may require combined therapy, and also you may have to totally remove the voice box. That's a very unfortunate thing. He will be ending up with a permanent hole in the neck and the ability to loss of ability to speak. But we can always make them speak. There are different mechanisms of making the people speak after they lose the larynx. He is using esophageal speech, means air in the stomach to set the esophagus vibrate. You know, we all belch. So the same principle, with the effect of belching, he can actually speak. So he's a priest. Mind you, he doesn't have a larynx, voice box, it is removed. And another is using an electronic larynx. This is kept outside. It's okay, but it produces sort of a robotic speech. But the best speech is with the tracheoesophageal puncture, TEP voice process. This person talks only when normally. He was an engineer. He lost his voice box because of the cancer. But he had this surgery done, the correction with the TEP.
ഈ പ്രോസസ്സിനാണോ അതോ മറ്റേ പ്രോസസ്സിനാണോ ബെറ്റർ വോയിസ്? വർത്തമാനം പറയാൻ എളുപ്പം ഇതാണ്.
You can see that almost normal speech. Now, finally, the laryngeal transplantation. We know that the laryngeal transplantation is relatively rare because the reason is that it is not an absolutely essential organ and rare indication. The biggest cause of the loss of larynx is cancer larynx. And for that, usually people don't do that because if you need to give immunosuppressant and they may actually develop recurrence. But this month, something really historical happened in America. They did the first laryngeal transplant for a person who lost his larynx due to cancer. So now indications are actually getting bigger. Till now, even less than 10 laryngeal transplantations have been done. In Asia, till now, nothing has been done. In Europe, 1 case has been done. 3, 4 has been done in United States, and 2 has been done in the first laryngeal transplantation. And this is Brenda Jensen, a lady who lost her voice. And she was speaking with an electronic larynx.
Very common.
This is after laryngeal transplantation. Mind you, she is still using the tracheostomy, but he can actually speak. So this is in a nutshell about the dysphonia. I know that is a huge topic, very passionate topic for me and many of you, I also suppose. And so before I wind up, I know that there is some time for discussion, but I think it is ideal time to play a lullaby, which Keralites are very proud of and fond of. This was written by the great Iraiman Thambi for our king, Swati Tirunal, who is considered a king among the musicians and a musician among the kings.
So actually, Zoom is not very friendly for music. You'll have to do some setting change and all for us to.
Zoom is okay for before and after surgery, Vidya. Those voices came out very well.
Yeah.
Thank you.
It's the problem is with the music, singing and this.
So I'll stop sharing now. Ken. Thank you.
Over to you, Unni. Thank you, Dr. Jayakumar, for a absolutely breathtaking, like spellbinding session.
Thank you.
Yeah, yeah, that's the right one, spellbinding. It's really fascinating, the topic itself and the presentation by sir. Especially the first part, as somebody commented, the brilliant move from phylogeny to the present. So it's really fascinating how evolution has allowed such a species, Homo sapiens, we say Homo sapiens, to have this particular faculty of voice and speech, which is so unique. But with its inherent, the quid pro quo, you gain something, you lose something. It's really fascinating. Dysphonia, the latter part, of course, is much more familiar to especially people in laryngology. We see these cases and we know. And as I said before, anything is there, we discuss with sir. So those parts was relevant. So I'm sure people would have questions to ask on the latter half, actually, dysphonia. So I can.
There are already a lot of questions in the chat box only. If you want to add something or you want to highlight something about what Dr. Jayakumar spoke, you go ahead.
The physiology part, somebody asked, Mr. Ravi Shankar asked, what is the biology of chest voice, head voice? Yeah, these used to be terms. Sir, you can just highlight on that.
Yeah, chest voice and head voice is actually the musical, the musicians using, they are the terminology being used by the musicians. But if you look at the scientific part, how the voice is different. Chest voice is sometimes known as the vocal fry, means the vocal cord meet and vibrate. We have seen that but here they meet much more thicker way, and that meeting part lasts little longer. So that means the lowest pitch. How do you know that you are producing a chest voice? Usually females don't produce chest voice, the male. So you put your hand on your chest and produce the lowest pitch. So it is like, oh, you will feel the vibration on your hand. That is the chest voice. That means you are in the lowest range of your frequency. The vocal cords are very thick at that age. That is very unique. Our string can become thin, thin, because depending upon the muscle contraction. So the vocal cord become very thick, and they meet for longer time, and they produce a very low pitch voice. Head voice is something, the upper part of the new model voice, where there is some nasality also. So when you produce a head voice, classical head voice, you will feel some vibration. The emphasis is around the mouth part. So I don't know how many of your Keralites in Kerala. I think the striking example will be the playback singer Afsal. He has got a real head voice. So it will be like, like this is the upper range of the normal, the middle voice, and above that there is falsetto, that is like that. They all need to be connected. So the head voice means the upper part of the middle register, and the chest voice is the lowest register.
Yeah, thank you. There's a question about post-menopausal dysphonia. Actually, that whole thing about gender and age is an entire topic in itself.
Yeah.
In terms of how the changes happen in the adult female during menstruation, and then the postmenopausal, and along with that, what complicates the age-related changes. So maybe a couple of sentences, sir. I think it would be too complicated to say in detail about that. The question is about postmenopausal dysphonia.
Yeah, the female voice, male voice also is subject to that, but female voice is more subject to the hormonal in the play. And the estrogen just doesn't beautify the body of a lady. It actually beautifies the voice also. So it improves both shariram and shariram. That is what beautifies both shariram and shariram. While progesterone on the other end make the vocal cord thicker, and so the pitch goes down. So any lady with a regular menstrual cycle have some voice problem in the progesterone phase. That is just 3-4 days prior to the period and first 2-3 days of the period. Then after menopause, the estrogen dips and the support of vocal cord is gone. So it is very common for most of the people lose some pitch, because estrogen makes the vocal cord thinner. So when the thickness of the vocal cord increases, naturally the pitch actually comes down. They are unable to go really high pitch. Of course, there is other things are happening, like there is some fluid retention, loss of muscle mass, all these things happen. But in females, generally after menopause, their voice actually, the pitch usually comes down a little bit.
Yeah, thank you, sir. Then the next question is one of our, as you'd like to say, laryngology, one of our favorite beating boys. The question is about GERD-related dysphonia. So reflex. It's a little tricky, actually. Yes, sir.
Yeah, there are the two groups of people in laryngology. There are people who are vehemently against it, and there are people who actually find reflex responsible for everything. But I think the truth is somewhere midway between. You know that when the acid comes up, that we all know that acid tend to come up. Acid tend to come up, and at the upper end of pharynx and larynx are common. So naturally, some acid will actually fall on the larynx, and we all know that acid is the enemy of water, and water is the biggest front of larynx. So larynx become dried up. There can be secretion and even some edema. It doesn't produce a real striking voice change or anything. In that, I agree with Dr. James Thomas, who has been a very big opponent of this GERD causing voice problem. But it produces some irritation of the throat, some kitch, and some change. That as a subtle high pitch may be lost because there is some increase in the mass. But probably it is an over-diagnosed condition in laryngology.
Yeah, thank you, sir. Next question is about Botox, but I think we can skip that because sir has mentioned about the condition spasmodic dysphonia. So Botox basically is now the gold standard treatment for that one condition only. So it's we can't generalize and say a treatment for dysphonia. Botox is specifically a presently the gold standard treatment for the specific condition which sir mentioned, spasmodic dysphonia. And then there's a question about Mauna. I think it's Vridham because of the spelling, English spelling sounds a little odd. Does Mauna Vridham help in maintaining the vocal cords? So there's this whole concept called as vocology and vocal hygiene. That again becomes an entire topic, but sir can just few points about the concept of vocal hygiene.
Yeah, vocal hygiene and voice rest. Yeah. And then now the voice, first he asked because Mauna Vridham, so I will talk about the voice rest first and then go to the vocal hygiene. Now, say when laryngology was not well developed, say 20 years back, when we were all students, any voice condition, patient has got a hoarseness, patient has got some problem, irritation of throat, we will advise voice rest. 2 weeks, 3 weeks, 4 weeks, lot of weeks, which most people are unable to do that. But now we don't know that that is not really the way. What we know is that the rule of 1:2. If you talk 1 minute, you need 2 minute rest, right? So that means 8 hours voice and 16 hours voice rest is the thing which is actually required. You need 16 hours rest. Imagine you sleep 1/3 of your day, 8 hours. So that means when you are awake, it has to be 1:1. That means if you do a performance for 3 hours, you should actually take 6 hours rest. You should actually take and rest. The problem happens when actually they lose this balance. Other than that, role of absolute voice rest has come down very, very, very significantly. Now we will never tell the new laryngologist will never tell a singer who is coming say that I've got a bad voice. Tomorrow I got a program. 20 years back, the ENT surgeon would have told cancel the program. Nothing. We won't do that because we know that that's a cutthroat competition area. If somebody is losing a thing, he's going to lose a lot of things. So we will make them sing with some medicine, some technique. There are only 2 major indications for an absolute voice rest. One, when there is a hemorrhage into the vocal cord. That's known as a submucosal hemorrhage. Second is immediately after microlaryngeal surgery. Then about the vocal hygiene. What exactly is the vocal hygiene? What are the things which are good for the vocal cord and what are the things bad for the vocal? We know that water is the best medicine for vocal cord. So make them sip frequently. That is the most important thing. They need not drink so much of water, but frequently. So the vocal cord is wet. And second, very fascinating thing is that bathroom singing, however bad you may be as a singer, still it will improve the voice. So you all do bathroom singing, switch on the shower, let the water go in front of the mouth. There you are actually breathing through the humidified air. I'm not a singer, so even I do that. So your voice will actually get wet, moist. That's actually a very, very good thing. So breathing humidifier is great thing and drinking water in between. Too much of alcohol, too much of coffee, too much of tea, they all are dehydrating agents, not very good. Avoid acidity. We have seen that by keeping a regular food habits and not going immediately to bed after food. Minimum 1.5 to 2 hours between dinner and going to bed. And for a lady, be careful about your premenstrual period. And one more thing, everybody knows that loud talking is not very good. But what people don't know is that worse is fast talking. I know that I have got a tendency to talk fast, but now I used to be even faster earlier. But if you talk very fast, chances are that you will develop some voice problems. So fast talking is the worst offender for the voice, especially for ladies and children. They are likely to develop vocal nodule. And don't speak in presence of background noise. There is something called the Lombard effect, right? So when you are in a train, you will be speaking, but without you knowing, you will actually raise the volume. This is quite damaging. And what happens to many performers? They will go for a program, they will do the show, then come back on the way back to home. They will keep on talking. That is worse because already vocal cords are taxed to the maximum and they are talking in background noise. And same thing happens with teachers. After 5-hour class in the day, they go back to their home in car or in bus and they talk all the way. Very, very damaging. So don't do that. So this is in a nutshell about the vocal hygiene.
Yeah, thanks, sir. I just reminded just to add on to that, sir, something that sir has taught us, which I keep telling my patients or anybody related to voice, that there are only two medicines for the vocal cords, for the voice box, that is air and water. I actually say that as a sort of mantra for anybody, and
Excellent.
especially this is distressing because we see a lot of cases of antibiotic prescription and steroids being given for voice problems and the so-called laryngitis. They're all very I mean, like from the era of dinosaurs, all this should be completely avoided.
Exactly. We are understanding it much better now than pathophysiology.
So somebody asked about Ravi Shankar has about do sinuses play a role in phonation? That has been spoken about. Sinus basically are resonating chamber. All the air canal cavity are resonating chambers. So strictly
But
speaking,
the sinus contributing the nasal resonance is minimum. It is the nose which is mainly.
yeah. So just to specifically answer the question, the question was, do sinus play a role in phonation? The answer would be no, because when you say phonation, by definition, it means what happens at laryngeal level.
Exactly.
So phonation is equal to laryngeal activity, and then there is a resonance, and then there is articulation.
So phonation plus resonance is voice.
Yeah. A question about the experience of this again is a little bit of a gray area, just like the GRD. This is about the dysphonia due to long-term steroid inhalers. Again, I think there are two schools of thought, but one is a major school which says, I believe nothing much happens. Even I have not seen, but sir, your take on this?
Yeah, but there are quite a few papers saying that the constant use of can actually cause some bowing and atrophy of the vocal cord muscle, and the vocal cord get bowed. But like smoking, not everybody gets it. So sometimes people who have been using for the steroids for a long time, they don't get it. And sometimes people who use it for only few months sometimes get it. So we don't know exactly the pathophysiology, but we have seen that, and there have been few papers. So then what we do is that if that happens, then we will actually discuss the case with the patient and the pulmonologist. And if they said, the pulmonologists say that, we cannot actually withdraw the steroid spray, that is fine. We say that you continue. We will try to bulk up the vocal cord with some injection laryngoplasty or something. Or if pulmonologists say that, no, I can actually stop, that is well and good. We will actually advise to stop the steroid spray.
And just to add on to that, very interesting catch-22 situation here, because as I was saying, as you'll realize by now, that the fuel tank is the lungs. So something wrong with the lungs, that it's also going to affect the voice.
Yeah, exactly.
So you can't, just for the sake of stopping inhalers, you can't let the lung status go down. So you need the lungs to be optimal for that person. So it's a give and take between how much inhalers to use and the.
That is why we always ask the pulmonologist opinion. So we go by their opinion. If they say that it is needed, okay, go ahead. We will try to correct.
And just an add-on to that, as what sir said, just to sort of a general info for everybody, that when we have voice patients, so we have this like a proforma, you asked these questions. So in investigations, in the proforma, the pulmonary function test, lung function test is a default entry in a voice proforma, because a baseline lung function is actually needed for, although we may not do it in every case, but it is a needed thing. So, that is there. The fact that good lungs is necessary for the voice.
True. Yeah.
Then this is a slightly interesting question, Dr. N.K. Majumdar.
Majumdar sir, I saw that. Sir,
So,
good evening. Good. Okay. What was the question? He told about the vowels.
Yeah, and after the question is very interesting. He said, can pubophony be corrected by breaking the pterygoid hamulus? I wonder what he meant by that.
No, sir. Because the principle is fairly easy. So we need not go to the pterygoid. I didn't understand how that helped, because anyway, you need to go there into the pterygoid hamulus. But vast majority can be actually corrected by the voice therapy simple technique, and even the type 3 thyroplasty is a very, very simple procedure. You can actually just push back the anterior 1/3 of the vocal cord inward and reduce the pitch. I don't know about the pterygoid hamulus breaking.
Yeah,
sir.
I was wondering.
And I think sir has also told about some vowel. He told something.
Vowels coming, lines, energy, constants, multiple lines, resonant column. Yeah, that's fine. That's you can add on to that. Yeah. There was some discussion about talking fast. So somebody made an interesting comment that fast is interpreted as fluency by some. That's true. Yeah, some people think that talking fast is fluent. Yeah,
And
and I
actually,
remember, sir, you sorry.
I will tell that, in a good speech, there is something known as 3 P's: the power, the pitch, and the pace, right? So
Yes.
you keep on changing the loudness, you keep on changing the pitch, and you keep on changing the pace. Then the voice become really, really impressive rather than talking in everything on that. That same pitch, same power, same pose. That really doesn't look nice. Any good speaker will have all these 3 change. And actually, I have added another P to that. That is pose. You know that big speaker, and especially our late Prime Minister, Adal Bihari Vajpayee ji, is one of the best example for that. When he speaks, in between there are, say, some 5-second, 6-second pause. So that makes his speech even more impressive. We will be keenly listening. What is he going to tell now? That he is very slow and steady, but there is a lot of inflection. He keeps the pause there, and it makes really, really impressive. So for a good speech, you need to change your pace, you need to change your pitch, you need to change your power. Power means loudness, and you need to put in a lot of pause in between. So yeah, talking very fast doesn't mean it is very fluent.
Yeah. I remember, sir, I just, if you just add on, just enlighten the audience about, so it's about the stage, the pre-cinema era, when all the things was about the stage and theater, how stage artists, especially some art forms, the whole training is about how to throw your voice. No,
Exactly.
yeah. So you could just a few points, and it's a very interesting part there.
And that is one art actually we are losing because of the microphones and all. Previously, years back, all these stage artists are, I think it is still there in many European countries, especially in UK, that. So the stage artists are actually taught to produce what is known as the voice projection. So what is voice projection? Voice projection means the ability to make the voice really loud, but without straining. So anybody can strain and make the voice. That's not really good. That is damaging to the vocal. But the technique of making the voice really loud without straining at the vocal cord. So here comes the technique of resonance. So if your resonance is very good, your resonating chamber or your microphone to your vocal cord. So if you are using the resonance very good, then your vocal cord won't be damaged. On the contrary, if you are putting strain on the vocal cord, your vocal cord will get damaged. I will show the correct way of loud talking and the wrong way of loud talking. So when I'm putting the M, I am not straining my vocal cord at all, but I'm just giving the big resonance with mouth cavity and good throat, the tongue projection. Then my voice will not get damaged. If I say ah, it is really loud. I don't have any effort at all. But on the contrary, if I go with my vocal cord and I'm pushing at the vocal cord, voice will be still loud, but you will damage it. So that is, I shouldn't actually doing too much because I will damage my own vocal cord. But the bad technique is, see that here the problem was actually stress was on the vocal cord, right? So this is the thing which you need to teach the speakers and all. They should never tax their vocal cord. They should always tax they should use their resonance. The bigger the resonance, the bigger the mouth opening, bigger the tongue projection, the better the voice.
So I remember that your one video used to show, I don't know how many Malayalis are there in this, that Nedugudi Venu, that Andolanam song, you saw that all the correct techniques are in there.
That's one of the most beautiful demonstration, actually. You think even the
about that open mouth, tongue low, that all those 4-5 points.
Super. Yeah. Even the great Devarajan Master called Nedugudi Venu and told that is one of your outstanding. Devarajan Master is known to be so stringent on praising somebody. So he told that was unbelievable.
If you could just share the link on the chat box, that would be great.
Of what? Link of?
No, you were talking about just now techniques.
Okay, this particular reference was to a particular. Yeah. Sorry.
I think in one chat comment, I told that even the pose actually makes even the songs better. Absolutely. I don't know how many of you are Malayalis, and because what I am going to tell is that there are 1 or 2 Malayalam songs which a pose has made it so beautiful. One will be the everlasting romantic song of Arigil Ni Undayirunengil. So they after Arigil, there is a pause. Then if you told Arigil, then there is a break. Then only you start Ni Undayirunengilennu Njan. Instead, if he told Arigil Ni Unda, that beauty is different. So it is so different. And same is Bombay Ravi song in and then Areyum Bhava Gayaragam. Again, there is a break. Areyum Bhava, like that there is a gap, and that gap at that the post make the voice that musicality so beautiful.
So there's one interesting question about science behind ventriloquism. So that's
Yeah,
real,
ventriloquism. Again,
real tough thing.
Yeah, in the beginning I told that at the time of the Saint Tyagaraja, we used Nabhi Hirtkandarasana. We thought that the food, the some voice is coming from the stomach, some from the chest, some from the neck, and some the mouth. Similarly, at that time we didn't know what is ventriloquy, so they thought that the voice was coming from the stomach. Ventral means it's actually for the stomach. So
The animal world, it's dorsum and ventrum.
yeah. So they thought that it is actually from the stomach the voice was coming. But what ventriloquy is, there are two parts. First, they produce in a very high pitch because it has to correspond to the voice of that thing he's keeping in his the thing. So they will always study. Actually, they are talking in falsetto like that. They will speak like that. But the key here is the second part. To get the impression that this doll is speaking, the speaker will not use his lips at all. So we understand somebody is speaking by moving our lips. So there are only few letters which require the lip, like pa, ba, ma, and u, like o and like. So a ventriloquist will actually tell without moving. So that particular letter he will actually avoid. So that, but by listening to the letter behind and after, the audience will understand. For example, if I want to tell my name Jayakumar, there are only two times the lip move. One is ku, right? Then the lip has to move. And the second is ma. So a ventriloquist will tell, right, actually I didn't do that. I didn't do that close. I didn't sell ku and I didn't say ma. But still, because the listening to the words before and after, the human mind will actually fill in the blanks and listen. Right, that's the way. Occasionally, you will come across there are a lot of bilabials, lip words. Then the ventriloquist will be very smart enough to move his hand like that at the exact time we won't be watching his lips. For example, if somebody wants to tell like that Mammootty and Mamukoya went to Mysore, it will be very, very difficult. You know that you can't tell that. How can you tell? So you can't tell that. No. So then he will actually build. Usually they will make the script that way that this won't come like that. But unfortunately, if he has to come, he will be very smart enough to cover his lip by either his hand or the doll. So that these are the two things: very high pitch sound and no lip movement. So
fascinating. Everything
only
about it
he can tell only who is the problem. So he can tell no movement.
Yeah. That suggested something like a little bit of hypnotism type. Suggested.
Thank you so much. If anyone else has any questions or comments, please feel free to raise your hand. Otherwise, over to you, Radhakrishna.
Very fascinating lecture, I should say. And I think all of us learned a lot of new facts. We didn't know that the thing about fishes and monkeys and snakes. I mean, I think this should be taught to undergraduates. And I mean, I'm sure Sir will be doing it. So we understand that voice has got such an important place in our human body. We generally do not ever give it a thought. But estrogen progesterone apart, I think women folk after marriage gather 2 octaves and men lose 2 octaves. And it remains like that forever. I don't know hormones have got anything to do with it. Having said that, I do not know. Do you have any objective assessment in like graphical from like ECG to say to diagnose voice conditions or to comment this is a good voice and this is not a good voice? So
Yeah,
it's an interesting
that's actually a
question.
good question. Now,
Yeah.
right now, the voice spectrometry analysis will just say that, this has got this much of jitter, shimmer. But unlike an audiometry can actually tell, okay, this is otosclerosis, something like that. As of now, we can't actually, by doing the voice analysis, we can't actually do the diagnosis. But now this is the era of artificial intelligence. I am sure that this is going to come. Now, already people have started doing that. So with the number of data, if the database is very big, suppose they take 1,000 or 10,000 vocal cord polyps and then do the voice analysis, then they will have a very clear-cut picture. So that is actually on the way. So in the very near future, that will actually come. The voice analysis, and they will tell that they will tell that this is more 99.9% it is likely to be a vocal cord polyp. But right now we haven't reached there.
secondly, in addition to what you said is bathroom singing, which isn't that easy, is there any other exercise, vocal exercise to keep your the voice fit as a part of everyday schedule?
Yeah, you develop your breath power. We have seen that the vocal cord has got three parts, and the voice has got three parts. The force, that is the breath, the vibrator, that is the vocal cord, and the resonator, that is the cavities. 70% of the voice problem is actually due to bad breathing technique, especially people who speak very light neck breathing, like that. This kind of breathing, this is not a good breathing. So it should be chest breathing and abdominal breathing. So anybody who is interested in their voice actually should spend some time for developing a breathing, for doing a breathing exercise every day, 5 to 10 minutes. And do what is known as the MPD, that is a maximum phonation duration, right? So if you take like that, say what is a max? Usually it should be 10 to 15 seconds. Any value above 15 is great. So you practice it, you can go to 20, 25, 30. So how do you do that? You relax, take a little bit of water, take deep breath, and say a vowel, usually E, for as long as you can. So it is something like you can go even more, but you have to practice that. That will actually help you to develop more power. Then pitch, usually it is for the singers. They know how to train, how to stretch their vocal cord. And resonance is the key. The best voice you can produce is always when you are smiling. Your lip should be moving. The upper 3-4 teeth should be visible. Some people speak, without moving the upper lip. They dull voice. So your smiling creates the best, brightest voice. So speak with smiling face and with at least 1 finger gap between upper and lower teeth. If you speak like this, very bad voice. If you speak open, that there are people who open the mouth really well, like Usha Udup, Remy Tommy, all these people, Barack Obama. So they have got all this brilliant technique. They open their mouth so much.
Thank you, sir. Once again, it's a wonderful lecture. Back to you, Vidya.
And there's a last question at the end. Kindly comment on Brahmari, a relaxation technique.
Yeah, Aarti, I saw that question. Yeah, right. So many people actually ask what is the role of pranayama and the voice, right? Now, in the voice, breathing is very important. So what you need is actually, for breathing, when you need both inhalation and exhalation, right? So just developing inhalation alone is not good enough. So you should actually develop good breathing in and a very controlled breathing out. That is why Brahmari pranayama is actually very good. So, but most of the pranayamas actually concentrate on mainly the good inhalation. Of course, there are different types. So in voice, the difference is that we are actually taking not only a deep breath, but we are actually using the exhalation in a controlled fashion so that we can prolong, we can keep the vocal cord vibration for as long as possible. So there comes the importance of Brahmari Pranayama. It's actually quite good for the voice.
Yeah. We are almost out of time. So if anyone has any questions or comments, you're welcome to post them now. Dr. Jayakumar, we just started, we've been doing this marvelous medicine for almost 4 years now, this weekly program on all kinds of topics. Just last month, we ventured into the real world. We've been doing only on Zoom, and last month we did our first program where we took the program to the medical college students at Mahatma Gandhi Medical College, Pondicherry. And so in the future, when we do another program, we really, it will be very, very wonderful if you could be part of that, because like Radhakrishna said, these are the things that, will really excite and, inspire our undergraduate and postgraduate students. Our audience is usually sort of more mature people, but we'd really be, very much obliged if you could be part of our.
Sure.
And thank you so much, Unni, for choosing this topic and also getting Dr. Jayakumar on board. I can't thank you enough. It's been a truly, truly fascinating session. We'll. So any
and
closing
wishing you a wonderful match at 10 p.m.
Yes, PV Sindhu.
Sir, any closing comments, sir? Dr. Jayakumar.
As a laryngologist who has been practicing laryngology for the last exclusive laryngology for more than 20 years, I'm very passionate about my field in larynx, and I think it is actually a terrific specialty because it deals with the 3 areas, the voice, the airway, and swallowing. So we just talked about the voice, an overview. Swallowing is an equally important field because there are scores of unfortunate patients who cannot actually swallow, either because of a neurological problem or because of a cancer problem. And this is an area where a tremendous stride has happened. So that is one area. And third is airway, another area where patient has got breathing problem. They have got tracheostomy, laryngeal narrowing. They all also can be correct. So it is actually a very fascinating specialty. I think what I will say that it is still not probably recognized. People don't know this specialty exists. Very few people know that actually there is something like laryngology. It is changing. I'm happy that more and more people are taking, more and more ENT people are taking. But I just want to spread the message that actually we can do a lot of good things, which will make the patient's life far more comfortable.
Thank you. Thank you so much. Unni, would you like to say something to round up?
As I said, it's totally my pleasure to have thought of this, when you asked me to do something, and the first thing that came to mind, because I'm in laryngology group, the easiest thing that comes to our mind is to something on voice. So then I thought that, like, what am I saying? If there was somebody to speak on voice, it has to be this person, no, not me. So that is I'm so happy that the obvious suggestion came to my mind at the right time, and happy to introduce her to some more people in India who are the part of Marvelous Medicine. So I'm also happy to hear you're so impressed with the talk that you've asked her to be a part of your live program whenever it happens in Pondicherry. So all this has been as a feeling of, getting a feeling of achievement, actually, as if as if I have done something.
I'll let you in on a secret. Puneet pulled you in just to make you part of the bandwagon.
I know that. I know Puneet sir. Jayakumar sir may not know Puneet sir. He was a gastroenterologist. He was actually the first surgeon of Amrita, actually. Puneet sir and wife Meenakshi, their ophthalmology.
Okay.
So, sir, Faridabad. He had left few years back to start the department in AIMS Rishikesh. He's also passionate in many things. Like when he was in Amrita, he was my guru for all the extracurricular activities. He introduced me to visiting, seeing, going for plays, and he used to encourage people to join the quizzing. He's not a quizzer, but he took up quizzing to encourage me, and so many things. So he's part of Marvelous Medicine. So he was the one who has pulled me into this group. Unfortunately, I think today is not there. He must have gone birding somewhere. He's also a passionate birder, bird watching and bird photography. So
Okay.
last known, he was in Indonesia, Papua New Guinea, some forest somewhere in Indonesia, photographing some birds. I'm not sure whether it's reached back. Today is not there, right? Dr. Vidya, I
Yeah,
think today
he
is.
said he unfortunately had a thing planned with his college classmates. So
Okay, fine. Last week, I think he was in some deep forest somewhere in
yes, Papua New
Indonesia.
Guinea.
Yeah.
True.
So yeah, it was a wonderful session. I'm happy to be part of this, and to let me plug my own program if you don't mind. See you all definitely on the last Thursday of September, right? When it's the non-medical top subject.
Yeah. So, Dr. Jayakumar, the last Thursday of every month, we do a session called Beyond Medicine. Otherwise, we call it Marvelous Medicine, which is on non-medical interests of practicing doctors.
So I will just let you in on one more secret. So sir is very much into, Jayakumar sir is very much into mythology. So that's a fascinating topic to listen about various aspects of mythology, but completely secular in the sense, not non-religious aspect of mythology, combining history with mythology and science. So, that is something to keep in mind.
That would interest us very much, sir.
Yeah. So that's just keep in mind one session, right, Jayakumar sir, if you don't mind.
Yeah.
So we'll be reaching out to you often and bothering you often, sir. Thank you everyone for joining in, and I'm sure those who didn't join will will really feel bad about missing out, but then the recordings will be available. So we'll meet again next week with another episode of Marvelous Medicine. Till then, take care and stay safe. Good night.
Yeah.